Good morning.
Good morning, everybody.
Good morning. All right, we're going to start that again. Adam Russo had us redo that good morning. So, good morning, everyone. There we go. That's much, much better. Rich Whipperford, thank you. I make certain we keep that introduction under 10 minutes next year with all of my high school accolades and Father of the Year awards. I am really excited to have this conversation with Rich this morning.
Glad to be here.
Thank you for being here. We in the preparation for best practices, we were seeking professionals and leaders in this space to talk about all the things that we desire to do as organizations, the feedback we get from you as health plan participants and member organizations in the captive about, and Rich and I were talking this morning, we seem to chase a lot of things inside the medical side of our captives around cost all the time. But yet, inside of organizations, we're rarely getting that big strategy of engaging the employees around their personal health. And not only their personal health, but their personal health within groups. And if we get the personal health upstream, the organization does well. So I'm going to introduce Rich in a few points before we begin, and just to kick us off with a few things. Chief Medical Director, Employee Health and Wellbeing at Johns Hopkins Medicine. Johns Hopkins Medicine employs more than 40,000 full-time faculty. You operate 6 academic and community hospitals, 4 healthcare and surgery centers, and Johns Hopkins serves 2.8 million patients per year. And your role is to help these 40,000 employees be healthy at Hopkins.
You're making me nervous, John.
Just tell us a little bit about yourself, your role. How did this all begin?
Yeah.
And then we're going to kind of start talking about what you have been working on for nearly a 20-year career, helping organizations be healthier.
Thanks. I'd say it started in college when I was really bored studying botany. So I was a biology major when I went into college because I knew I wanted to go to medical school. So I was studying a lot of plants. I'm like, I can't study this for 4 years. So I changed to nutritional sciences, and that was a really interesting education. Went to medical school. I liked everything, so I decided to do my residency in family medicine. And I got out into the real world and started seeing patients. And it only took a year before I became disheartened because I didn't feel like I was making a difference. I only had enough time to write a prescription or order a test. My patients really needed my time so that I could help them understand what they could do to help themselves. Healthy choices, healthy foods, exercise, etc. And one day, a light bulb went off. While I was running between rooms every 15 minutes, my patients were running back to their jobs, where they were spending almost 2,000 hours a year. That's when I knew I needed to be there. You have much more impact. You are much more likely to make a big difference in the health and well-being of the people you work with than the doctor they see. Don't underestimate the role you can play in shaping the health and well-being of the lives within your organization.
That's when I read your book in preparation for this. It was clear that is obviously your common theme, and the fact that employers are really empowered with an ability to educate employees. And what we're going to talk about today is just some of those. How do we even get started? What does success look like? What do programs look like? But I think your perspective on the organizations in this room and the leaders in this room, I think is also important around your background. So in addition to writing the book, Cure for the Common Company, a well-being prescription for a happier, healthy, and more resilient workforce, which is, by the way, Dr. Sapir is going to be doing a book signing after. You are also the former medical director at Care First Blue Cross Blue Shield, which is the Blue Cross Blue Shield plan of Maryland and Washington. Describe a little bit about being the medical director of an insurance company and the frustrations perhaps, and this is me leading the witness, as I said yesterday in one of my moderating sessions, some of the frustrations you saw just at the employer level. What were some of the things you're trying to accomplish in that role, and where did you find the challenges, and where did you find the victories too?
Sure. So first of all, it's not like I grew up thinking I wanted to be a doctor for a health insurance company. My thoughts only landed, I'm going to be a family doctor. I didn't think I was going to be having multiple jobs, but I'm glad I worked there. And I fell into the job because they needed a physician to help oversee their prevention strategy. So there was a huge opportunity because CareFirst Blue Cross Blue Shield insures 3 million lives. About a third of them are self-insured, and I spent a good chunk of my time working with self-insured employers. There was a huge opportunity to help increase awareness of the possibilities. The frustration was that, believe it or not, many people don't trust people who work at health insurance companies, even if you're a doctor.
How about health insurance captives?
I can't, I'm sure this captive.
We'll talk about that later, make sure we hit that one.
So I would meet with my human resource colleagues, and there were a lot of head nods, and yet the movement forward wasn't great. Where there was a lot of success was in our fully insured business, because we had full control, let's say, over that. And I was pretty proud. We put together resources in a package. For those of you who are familiar with NCQA, it's a standardization process within healthcare. And we were amongst the first 4 health plans across the country to be NCQA accredited in health and wellness. So we had all the right tools there, and fully insured companies were taking advantage of it.
Interesting. What I really want to get to next is the longer-term strategies of employer-based well-being strategies. And I think that's such a broad definition, but in the role that the chairs that we have seen from the advisory side of things, we've been in what I like to term sometimes of a stoplight, not this group, but the industry itself, a stoplight to stoplight strategy of just looking at things in a 12-month annual kind of renewal cycle. And there's a book that many of us were recommended by Dr. Marty McCary 2 years ago, actually. And one of the quotes in that book was by Dr. Peter Attia, and people have heard me say this from Bishop, it's from Desmond Tutu, excuse me. It says, there comes a point where we need to stop pulling people out of the river, and we need to go upstream and find out why they're falling in. And that's, when I read your book, and what we want to kind of work through the audience with is just those notions about being upstream and the ability to mitigate events and mitigate risks inside of an employer before it comes a cost that comes down to the insurance side. So could you maybe just begin talking about, let's just jump right in. Your strategy at Johns Hopkins Medicine for these 40,000 employees is called Healthy at Hopkins. And as I dug deeper, you actually have an Office of Well-Being. And we recognize it's a large organization, you have some resources, but you're doing some things that an everyday employer could actually do. But walk us through Healthy at Hopkins and the relatability to organizations in this room.
Sure. Well, first I'll just state the obvious. We all spend most of our waking hours working, which is why the workplace is the right place to be spending your time, focusing on health and well-being. And the longer your employees stay with you, the more important it is for you to be investing in their health and well-being, because if they're with you for a few decades, hopefully they're going to stay healthy that time, but that's a long enough time for them to start developing diseases and illnesses that are going to be bad for them and bad for your company. So Healthy at Hopkins is our branded employee health and well-being program. We have a vision where our employees will leave work happier and healthier at the end of the day than when they arrived, which is a big order. And our philosophy is that most people know more or less what's healthy and what's not healthy. we need to make it easier for our employees to have a healthy workday. And so we take two general approaches, and then maybe we can explore some specifics.
Right.
So one general approach is making sure we have an infrastructure in place. This is business to us. This isn't a nice to have. We need to make sure that we have our infrastructure in place so that we can create a platform where there's a broad range of services and resources for all employees. We use the CDC Worksite Health Scorecard, and if you want, we can come back.
Yeah, we're going
to
to talk about that. That's
okay.
A fascinating scorecard.
The other framework that we use is creating a culture of health, a workplace where there are shared behaviors, beliefs, and attitudes supportive of employee health and well-being. And that's a framework that is outlined in the book, and we use the concepts in that framework to address whatever we are deeming to be our important topic or topics to move forward.
You said something I think really important, and perhaps even before you get into Healthy at Hopkins, you said this is a business strategy.
Yeah.
Business. I mean, obviously, Johns Hopkins Medicine is a healthcare facility and, of course, a university. But you look at this as a business mandate.
Yes. Yeah.
Who in your peer group at Johns Hopkins said this needs to be a business mandate? How did it get to that point, and then Healthy at Hopkins was created?
So when I was at Care First Blue Cross Blue Shield for 7 years, I was like, okay, it's time to go, because I wasn't seeing progress in these self-insured employers. And I was pretty sure if I got inside a large employer that I would have more success seeing change. And the largest private employer in the state of Maryland is Hopkins. They posted a job for a medical director for their insurance, their employee insurance. I didn't want to do that job anymore. However, I knew, based on the interviews I went through, that they didn't have an employee health and well-being strategy. So I got the job, I worked the job I was hired for, and I created the job I wanted. And at one point, I was in the conference room for the president of the health system, and I had already given him one presentation on our healthy beverage strategy, and I was finishing giving a presentation on measurement. And he agreed to the measurement strategy that I proposed. And then I said, I think we should include this as a strategic objective for our organization. So Johns Hopkins Medicine has 12 to 16 strategic objectives every year that is tied to the business performance of the leaders of these hospitals in different parts. And so what gets measured gets worked on, and especially when it's tied to an executive's performance. And so I knew coming into my role at Hopkins that best practices indicate you need to build employee health and well-being into the business plan, or else it won't be treated as a priority.
I think that's and we're going to go deeper on exactly that as a business strategy. So when you began to build the Healthy at Hopkins, as you refer to them in your book, your building blocks. Let's just begin talking about how to build this, how to begin inside of an organization that, hey, we need to make well-being and employee health a priority. What would you guide this audience to? Like, what would be next? And you do talk about some of your key building blocks. Yeah. What are those building blocks that they could start with?
So there's no doubt that nutrition and movement and sleep and low stress, they're all very important. The question is, how are you going to help your workforce embrace and actually practice these healthy habits? And this framework, the building blocks, it's basically a compilation of social sciences. It's setting up the kitchen so that the dish can be prepared and eaten and be enjoyed. And so these 6 building blocks include peer support, leadership engagement, norms, shared values, culture connection points, and social climate. There's a lot to unpack in each. Every one of them is important. I'll just give you one, peer support, as an example, so you kind of get a flavor for this. We are much more likely to succeed in creating a healthy habit or getting rid of an unhealthy habit if we have someone to do that with. Smoking is a great example. If you want to quit smoking and you quit with someone you live with or a friend, you're 50% more likely to succeed. And you can find data on all these other habits and mental thought processes that would show you that the people you're friends with and your family members play a huge role in your likelihood of being healthy and well.
I'm thinking one quote that I noted here, I love, in the book you say that well-being culture building is a team sport.
Yeah.
And let's continue down this path of I think sometimes we were all part of these health and wellness plans early on, right after the Affordable Care Act, and even some of these early BevCap members and some of the other captive members were doing, quote unquote, what the industry said were best practices. But I think they were very individualized, a John health risk assessment, a John biometric, but we weren't really doing a lot as a team.
Right.
But you feel that inside your strategy, it's evolved where you say well-being culture building is a team sport. Talk more about this.
Yeah, I mean, I've been working in this space since 2000. So I'm also part of the cohort that do a health assessment, figure out what programs you need, and it has very limited utility because there you are at work all day, and let's say that you're at risk for diabetes, and you know that you need to move more and you need to make healthy choices, and you sit down and you're given for a meeting and there's a plate of donuts in front of you. Now, I eat pretty healthy, but if you put a plate of chocolate in front of me, I'm going to eat it because I like chocolate, and you just made it really easy for me. And so we really need to be thinking more broadly. And very unlikely any individual can be successful with all of their health and well-being goals without the support of the people in their lives, including the workplace. So there's a lot of different social dynamics at work. We talked about peer support, so coworkers, the people on your team. Your immediate manager, of course, has a huge impact on your health and well-being. The social climate, which is more of a general feeling about the workplace and how all of the personalities come together. Are you creating a positive environment where people feel that there's a sense of belonging and everyone feels like they're working towards the same goal? So there are a variety of different social influences that when we pay attention to and we're intentional, we can be much more successful with our strategy, regardless of whether or not you're trying to help your workforce eat better or move more or lower their stress.
One thing I think each organization here is, of course, different in different regions and different cultures and identities. Something that struck me when reading about this was, if you could maybe I think you touched on it a little bit, but how norms, just our company norms, work on us and our organizations, and perhaps sometimes it's inertia to get it's hurting that we've got these norms, and it's just who we are. We could never do that, but yet you're guiding a ship with 40,000 employees, and you told me about a program that's getting nearly a third of participation. So talk to us about these workforce or company norms that sometimes we have to just push through.
So norms are the expected and accepted behaviors of a group of people. And we all live within them. And within the workplace, there are many. One norm could be that your workforce eats through lunch. And if you're the new employee and it's
What's wrong with that?
if you're
Oh, sorry, that's a BevCap standard of
well,
eating through lunch. So just ask some of my teammates.
we'll have a tutorial
Oh, okay.
afterwards.
Okay, thank you.
So if you're the new employee and you show up for work and it's 11:54, you're trying to figure out, okay, where are people going to eat lunch? Where's that break room? But no one's moving. And maybe at 12 you look around again, still no one's moving. And at 12:05 you're like, okay, I'm going to walk to the bathroom. Maybe I missed them all. They all left and I didn't see it. You walk to the bathroom and you see that someone's sandwich is half eaten. And on the way back, you see somebody else's salad bowl is half eaten. You realize, oh, I guess I'm eating at my desk today. It's really hard to step forward and do something different than the rest of the people around you because we all want to feel as if we belong. And in the workplace, there's an additional pressure or force. Not only do we want to belong, we want our manager to feel as if we're contributing to the team. Not too many people want to feel like they're the slacker. They're the one who's letting the team down. And so doing the right thing, which would be to take a break and eat lunch, can be difficult. But the benefits of taking a break, whether it's lunchtime, mid-morning, mid-afternoon, of being able to calm your mind are tremendous. Because when we return to work, we're much more focused. We're more patient. We get along better with the people around us. We're less likely to have an accident in the workplace. So we need to be very thoughtful about how we undo unhealthy norms. And it's likely going to need some leadership to help make that happen because, as I said previously, it's unlikely that the new person, for example, is going to come in and say, we're changing this.
I really like that point about norms. I think that we just assume so much about just going to work and, well, I guess this is just how we always do it. But we want change, and it's true. It's leadership. As I say, this is what leadership looks like. It's just trying to undo those norms that sometimes aren't working.
And most of us here, we all have a health goal, at least one, right? And so if we're trying to work on our health goal and we're at work and everybody's swimming that way and we want to swim this way, it's going to look a little bit weird. And it makes it very difficult for us to achieve our own health and well-being goals.
One of your key building blocks, and I want to kind of tie into that norms, I thought was really if there's ever a time to talk about this, it feels right now. You state that a building block for the strategic plan is a supportive social climate where we've got all these people we're working with in this multi-generational workforce, and what we're bringing to the social climate today feels like a lot. And it could be, you name it. And I want to, talk about it. It could be political. It could be what you believe in and your religion, you name it. But you discuss this as a key building block, a supportive social climate. Talk about a little bit about that.
Yeah, so a social climate is the way we feel about the people we work with. And it can be shaped. It can be shaped by focusing on three areas. Is it a positive work environment? Do people see the cup half full, or do they see it cup half empty? Is there a sense of belonging, like people feel respected, there's trust, no matter what your religious background, your political belief, or other interest, that you're accepted? And then the third piece is that you feel as if we're all working towards the same goal. Some would say that you're on the same team.
Right.
Because if you feel like you're out here and other people are working the other way, it's not a good feeling. We all want to feel like we're part of a team that's going to succeed together. If you remember when you were a child, I'm picking childhood because many of us are no longer playing team sports. I'm no longer playing team sports. If you were on a team sport as a kid, remember how good it felt to be with all these other kids when someone scored a goal. You all celebrated together, whether you were the person who scored or not. there's an intangible feeling that we want to have. It's really some of the essence of what is well-being.
Right.
It's that feeling inside that is created by a variety of different avenues, including the social climate.
Let's move on to some of your best practices around this strategic plan. There's a part in your book about this is investment, not cost. And you kind of led with, this is a business mandate at Johns Hopkins Medicine. Talk about a little bit the framework that you see and the other organizations you've studied outside of Johns Hopkins that look at a well-being culture as this investment, not cost methodology.
So this is one of the biggest challenges companies face. Are you going to spend money on this area or not? And in my opinion, and what has been borne out in many organizations, is that you might rethink whether it's a cost or whether it's an investment. If your software is outdated or your computer is outdated, you're going to get new software, a new computer, because you're going to want to make sure that you can work efficiently and effectively. The same is true with your workforce. If you have people showing up to work who have a headache, what's the likelihood that they're going to be able to give you a full day of work versus the person who doesn't have a headache? You're spending a lot of money on their salary and benefits. Don't you want them to work to their potential? So depending on what the cost is, depends on whether or not you, how you might approach that. So I'll just give one example. When I started working at Hopkins, one of the benefits for our employees was that they could sign an affidavit that said, "I don't smoke." And you turn that affidavit in and you got a $500 incentive. That's pretty nice. I looked at the data and it turned out we had the lowest smoking prevalence in the state of Maryland. It was shocking.
Shocker.
I was also getting emails from people saying, "Why do I have to walk through this cloud of smoke when I enter this building?" I was like, these two things don't make sense. And so I did some research, and my proposal to the executive team was, let's do a tobacco testing. We'll do it for 2 years, and for those people who test negative for 2 years, they won't have to test anymore. The people who test negative, they'll get $500, and the people who either don't participate or test positive, they don't get the $500. And I did the math for them. Here's how much it's going to cost to get the testing done. Here's how much we're spending on this incentive right now. Here's the public health data. Like, this is the percentage of our employees who probably are smoking versus the percentage who are recorded as not smoking. And the math was much in our favor, and it turned out that way. I'm not asking people to guess. I think guessing is a bad strategy. There's usually a mathematical way to figure out whether or not it's cost effective and it's an investment to do a part of your employee health and well-being strategy. And it may come in the form of claims, disability claims, health insurance claims, workers' compensation claims. It may come in the form of recruitment and retention. There's a variety of ways you can look at, and if you don't have specific data yourself, you can find the data in the published literature, or you can ask someone to help you find it.
Let's discuss incentives. I think in a lot of what we do inside of our health plan captives, we create insurance plan incentives to hopefully change a behavior.
Yeah.
But inside of workforce well-being, what's your general position on offering incentives for this quote-unquote change or healthier behavior?
So I just want to clarify the behavior change that you're trying to encourage in a captive. Are you trying to change the choice they make?
Right.
Okay, so it's a
Right.
it's a didactic choice, right? It's one or the other. Okay, so and I, from what I understand, you're doing great work. I mean, this is working, and that's great. And there are places for incentives in employee health and well-being when you want your employee to make a choice that's on or off. yes or no. And we do that a lot. We do it to capture data. We do that to get an employee to get their blood pressure checked. And then there's using incentives to help change behavior that's on a continuum. And what I mean by that is, we make a lot of food choices every day, food and beverage choices every day. And it's not like one day is the same as the next. And so trying to give an incentive to make the whole day completely healthy choices, it's tough, especially with habits that we have grown up with and that we have arrived at our adulthood having learned certain things and behaviors throughout our childhood. That's a lot more difficult. I would caution you to not go down that path. Most likely that will not be a successful path for your dollars because there's a lot more involved with changing habits than there are in making yes or no choices.
Let's continue down how we get this strategy inside deeper in the organization. And a big chunk of your book you devote to the managers getting involved and manager training.
Yeah.
And we too believe in the risk management inside of captive culture is about getting multiple leaders involved. But you've had some pretty strong success there. Talk about getting the managers involved. It isn't just a directive from the executive team down to an email to 40,000 employees. We've got to get the managers involved.
My guess is that every one of us here has a manager, and we've had many managers over the course of our career. And I'm also going to guess that some of them were better than others. And it's kind of like when you're a kid and you have a gym teacher or a team coach. Some of them are better than others. Some of them help. No matter what the combination of their skills are, you feel better inside when you're around them. And for others, you don't feel good around them. And so your manager impacts your health and well-being every day. It may not be overtly, it's going to be much more subtly, but they do. And they don't know that they're influencing your health and well-being because no one's told them that. There's just tons of data that shows that supportive managers are much more likely to have a team that stays around and is more effective. In order for you to succeed, in order for us to succeed in all facets of our organization, of our company, we need managers to understand the power that they have because they're working with their team 40 plus hours a week. It took me 3 years to make the case to our organizational learning and development team to make the case to include an hour of health and well-being in new manager orientation. 3 years, and I finally got it in. And it was the essence of it is about how managers impact the emotions of the people they lead. And then it was running for about 3 years just for the new managers. If you were already a manager, you didn't have to, there was no grandfather, you didn't have to do that. Well, as soon as the pandemic hit, about 3 months into it, all of a sudden, it became mandatory for everybody. Because we're not usually thinking about how the manager, we're saying, okay, this is the responsibility of HR, and they're going to take care of all this. And it's good to have someone or a team responsible, but that person or that team can't do it alone.
That point right there, I think, is where the organizations in this realm have probably seen the greatest success, and we're trying to get our messaging into the manager group inside these organizations. I completely agree with you. Let's talk a few more.
Can I just give another plug for orientation?
Yeah, please do, because I think yesterday one of our keynote speakers talked about working 2,000 hours a year and you get 1 hour to learn about your benefits. So please do.
Well, I shared the last example because I thought it was a good story about how we started. We now have 5 different training and development programs related to employee health and well-being.
5 different
5
programs?
different ones, yeah. But orientation is a key time. You're making a first impression, whether it's a new manager or it's a new employee. So you might want to think about how you use that time to send a message and set the tone and the pace for how you want your new employees to be with you, your company, for the rest of their time together.
I think that's a fantastic point to take home. A few more ideas around the strategy, and I want to kind of talk about some of your programs here. Discuss, I think it's so important. You highlight marketing and branding of the strategy inside your organization. Give a few, learnings of what you saw at Johns Hopkins about marketing this well-being strategy.
Well, marketing and branding with every facet of life, it makes a difference as to whether or not someone feels like they're attracted to the concept, to the idea, to, in this case, the employee health and well-being strategy. Remember when the internet was starting and every address was at AOL.com? There was always this at symbol, and everyone was marketing this, that, and the other thing with an at symbol. So it was, when we started, it was healthy and then the at symbol Hopkins. And so I got to Hopkins around 2012, and it was already starting to be a little dated. So our branding and marketing essentially shows some images of 3 people who are different size and shapes for very specific reasons that we want people to feel like, hey, it doesn't matter where you are on your health and well-being journey. One mistake that often happens in marketing employee health and well-being is you always have these people who just look like they're out of the catalog, because they probably are. You really want to be able to relate with your workforce. And you may even want to use members of your own workforce in your marketing and communications. That helps people feel like they belong. We use a lot of our own employees in our marketing and communications material. It's not just our brand.
I've submitted numerous pictures of myself for ours, but they always get declined.
There is a limit.
Yeah, there's a limit. So we'll talk more about that. In our final 20 minutes here, let's talk about some of the programs that you do have at Healthy at Hopkins that perhaps the audience could say, wow, we've never thought about that. Specifically, you and I were talking this morning about cancer screenings, but something you really highlight is BP Squared, which is a program that you talked about of blood pressure. And when I think of well-being and strategies out there, you're really focused on blood pressure. Talk about this with the audience.
When there's a variety of choices that you're probably facing. Should we address nutrition? Should we address sleep? I mean, the choices are endless, because most of us have more than one health and well-being challenge. I'd suggest that you look at data. If you have access to data, it could be self-reported data, it can be claims data, and to arrive at a decision that's not only going to help the individual, but it's also going to help your organization. So for us, we looked at self-reported data and health insurance data. We also looked at public health data. A few years ago, we concluded that if we focused on blood pressure, we were going to be able to help the vast majority of our workforce, and we would be addressing a very high cost area for us. So the public health data indicates that about 45% of American adults have high blood pressure, and another 30% or so have pre-hypertension, or they're at risk. That's about 75% of adult Americans. That's a lot of people. Another alarming statistic about high blood pressure is that about 20% of adult Americans, or 15 to 20%, don't know that they have high blood pressure. High blood pressure is silent until it's not. Stroke, heart attack. It's very unusual to have symptoms from high blood pressure, and when you do, you're usually in the ER. It also happens to be the most costly chronic condition for many employers, probably in the top 3. And so it's people who have hypertension and all of their costs. The other interesting thing about hypertension is that it's really, in my view, a canary in the coal mine. There are a lot of risk factors for high blood pressure. Poor nutrition, lack of sleep, lack of movement, smoking, lack of social connectedness. And each of those items are risk factors for other chronic diseases. There are risk factors for diabetes. There are risk factors for cancer. And by picking blood pressure as a focus point, we're able to not only help a large portion of our workforce, but we're also able to integrate, we're also able to integrate these other important health and well-being aspects and all tie it back together. I'm all for cancer screening, and I know it's costly. It's very costly. The challenge is, when do you find the cancer? How many people in your workforce will have the cancer? And what is the opportunity cost? What are you giving up if you focus on cancer? And so it's something that you're going to have to wrestle with.
So if I heard you right on your blood pressure strategy, it seems to be it's so comprehensive that it covers so many other things. It's the feeder into all those other things.
Yeah.
And it's been the drumbeat for Healthy at Hopkins.
Yeah, since 2019. We had a little dip in 2000, shortly into 2020 and 21. We had to kind of step back and apply resources elsewhere. But it's really been a focal point for us. Blood pressure and stress. So the other nice thing about blood pressure is that you can get hard numbers, not just the number of people who are getting screened, but you can actually get blood pressure data if you use a third party. As an employer, you don't want to know your employee's blood pressure. That might get you in trouble. And the reason why that's important for us is twice now, in the past 6 years, I've been able to demonstrate through 2 matched cohorts. So a matched cohort is the same people in year 1 and the same people in year 2. In 2 matched cohorts, we showed that we increased the percentage of the percentage of employees with a healthy blood pressure reading. We don't know what they did because we're not going to, so the most recently is between 2023 and 2024. We had more than 4,000 people in the matched cohort. We probably had close to 8,000 in 2 different years, but we had to make sure they were the same ones. We don't know what they did. We certainly have resources within our workforce and benefits, but maybe they didn't use any of them. Maybe just the experience itself caused them to have a conversation at home. The important point is that we have a metric that we can use to see if we're going in the right direction.
Take that one more step into, and you and I spoke about this morning, the bridge to occupational health.
Yeah.
Many organizations in this room have employees in warehouses and driving trucks or making the best butter in the world in California. Walk us through how you see some of these programs lending itself into better occupational health and less risk and higher safety scores, you name it.
I've had a very non-traditional career. I had a non-traditional education. I was one of the very few people who studied nutrition before going to medical school. So My third job outside of training was to lead an occupational health office. I did that in Baltimore City. Some of our clients were the city firefighters, the county police, Domino sugar workers, prison guards, and we had quite a number of employees who needed a a commercial driver's license. And that's where I learned about CDLs and the health parameters. And so if you want to be a commercial driver, you need to have your blood pressure under control. And so there are companies represented here who have a lot of commercial drivers, and your drivers are getting their blood pressure checked. And this is an opportunity to tie in, if you were to go down this path. Listen, you can have a normal blood pressure, but you may not be healthy still. You might be eating lots of salty foods, you're sitting in a truck all day, you're stressed, etc. But you're on enough medicine that your blood pressure is staying normal. And I'm all for using medicine to keep your blood pressure normal. The challenge is that those same risk factors are probably increasing your employee's risk of developing diabetes, of developing a cancer, etc. And so what you have is some insight. You have a window into what the problem, the potential of the problem at your hands beyond your health plan claims. I mean, there's all different ways to get data, and I would strongly suggest that you leverage your occupational health data, and depending on who's providing your occupational health needs, you might even integrate your occupational health provider into your employee health and well-being strategy. Because let's face it, most people, not everybody, most people trust a nurse or a doctor before they trust, when it comes to health, before they trust a manager or a CEO, right? Because they're going to these nurses and doctors because they have a name badge that says doctor. They did something to get it.
Right. In our final minutes, Rich, let's talk about, you talk about your measurement partners are really important in this strategy. So we have a strategy, we've done some programming, we're getting some traction, but let's talk about your measurement partners. And specifically, you cite, and I did not even know this after a few years of doing this, there's a specific scorecard from the CDC called the CDC Worksite Health Scorecard. And I reviewed it last week in preparation. It's quite comprehensive. It's very strong. But talk about, one, your measurement partners, and then talk about the use of this scorecard for organizations.
Yeah. There are a variety of organizational assessment tools available. So the American Heart Association also has one. There's an organization called HERO. We chose to use the CDC scorecard for a variety of reasons. As a healthcare organization, it made sense, first of all, to tie ourselves to the CDC, but it's much more than that. These organizational assessment tools, they cover a variety of different categories of health as it pertains to the workplace. And the good ones have made decisions about what should be in the scorecard based on published evidence. And so the CDC scorecard, every question in it has 1 to 3 references. And it covers primary prevention like healthy eating, nutrition, secondary like vaccinations, and tertiary, which is like hypertension, diabetes. What can we do to prevent bad outcomes from those illnesses? It's very low tech, so you don't need IT resources. You don't have to send data to another company, so you keep the lawyers out of it, and it's free. And so we did start using it back in 2014. We piloted part of it, and then we worked out the kinks, and we administered the whole tool in 2015. The reason why I like organizational assessment tools is for a variety of reasons, including that the good ones will give you benchmarks. So you can compare your results against other companies in a similar industry. And I think that's important for us because we all want to be the best, right? We want to be successful in what we do. We know that companies with healthy and well workforces are more likely to succeed. So here's a way to measure up against other companies. The other reason why I like it, it takes the opinion out of the conversation. And what I mean by that is when you get into a conversation within your workplace, within the decision makers about what we should do with employee health and well-being, unfortunately, we all have our own experiences. And it's really hard to separate our own experience from the science. And once you make the decision about which organizational assessment tool to use, you and your colleagues don't have to debate any longer about whether or not this question should be done or not. It almost levels the playing field, and you brought the referee in. Now, just a footnote on the CDC scorecard. Due to recent changes in the federal administration, that scorecard will no longer be supported by the CDC. And what I mean by that is there's software through the website, there used to be, they took it down just recently, that you could have entered your data and used it to track everything. We actually never used the data, the software, when we started. We created our own Excel spreadsheet for a variety of business reasons. So you could still use it. The PDF is out on their website. I
saw that. It's a PDF.
And so don't just not do it. We're probably not going to be getting benchmarks in the future, though, which is disappointing.
Oh, I'll say.
Yeah.
Rich, a few minutes left here in closing. You and I talked about this just for the audience. If I only have time to do one thing in 2025, or as I'm doing my planning for my leadership group in 2026, just help the audience. If I've only got one or two things to do, what would it be?
This is always a tough question. So this is a room of decision makers. I would put well-being on the agenda, literally. You have regularly standing meetings, and I would make one of the standing items well-being. It's a very broad recommendation, but my reason for giving you that recommendation is because that serves as a placeholder. You will always, going forward, be addressing well-being. You're going to have to figure out where you're heading, and I think the book will give you a lot of good ideas. But if you don't have a regular placeholder, it's pretty easy to forget about it. It's like anything else in your organization. When something's new, it requires attention. If you plant a seed and water it for 3 days, and then you come back to it 2 weeks later, it's probably not going to be living. You're going to have to keep a placeholder for it. I think I heard you say or two. So the second one is once you land on your strategy, I would recommend that you build it into a business goal each year. And you got to hold people accountable, just like you do with your other business objectives. This year, our strategic objective is to have our affiliates, we've got 10 different parts of Hopkins that use the scorecard. They need to score a minimum of 235 points, and they have to have at least 30% of their workforce submit their blood pressure to get it screened. And this is, at the end of the year, our fiscal year ends at the end of June. Each of the C-suites and these 10 affiliates, they'll have this list of different objectives and goals, including the well-being one, which will be reported out.
Fantastic. Ladies and gentlemen, Dr. Richard Safir.